How much does money play into program development in the hospital?
That's a good question. The two experiences that I had, one was for a nonprofit and one was for a for-profit. So I definitely saw a very different approach to moving through the process. The difference really was within the cultures, quite frankly, and independent of for-profit, nonprofit. What do we want? Well, we want to be the best. We want to offer the best care to our moms. That's all of our goals. What does that look like? Well, our vision is future vision of it. Every mom gets a therapy consult after C-section. Okay, that's great. Okay, well, how do we make that happen? And I think the difference in those two organizations were problem-based approaches versus solution-based approaches. And nonprofit is very solution-based. Great. Okay, yes, we're going to have barriers. We're going to have challenges. We only have so many therapists. There's not enough of us. How are we going to do the best that we can to execute the plan? Whereas the other organization, it was a little bit more very problem-based, barrier, and certainly challenging to be able to work through. And my biggest thing is when you're looking at these two situations, well, where do you start? And I always look at work with the willing. You got to get momentum, work with the willing, and then begin to move the needle, build the process, and see where everything lies.
Dr. Michelle Figueira, wow, I always have the really rare opportunity to speak with you and just get deep on topics that I can't ask most acute care managers or former directors of rehab. We can't have these conversations the way that I've had with you in the past. And so for people who don't know you, can you give a little bit of your background as to what led you from clinician into leadership and to really have a passion for personal and professional development? What led you there?
Yeah, definitely has been quite a transition in a few different areas of practice for me. I've been practicing for 18 years now as a physical therapist, and I started really in the hospital setting. I really found my first passion in the ICU and working with patients that have had, traumas that have really just taken what their life was like and totally changed that moving forward. I really learned so much from those experiences that I knew that I had leadership in my blood and that I was looking for opportunities in that way. And I was lucky enough to transition over into another healthcare system up in the Northern Virginia area, Centera Healthcare, where I had the opportunity then to step into the leadership role and manage a team within a hospital setting, speech therapist, occupational therapist, and physical therapist. And that's really where this whole passion grew for postpartum care. I will take no credit for coming up with the idea. This was brought to me by one of my staff therapists who was treating two twins in the NICU. And she came to me and posed the question, Michelle, I just saw these two babies with the mom and mom looked god awful. I talked to mom, why are we not involved? And that's what was a jumping point for me to really come into this area and explore it and to really open up so many doors and continue to advocate for the necessities that we all know are out there. And where we still need to have, continued work to further the progress of the work that you were doing and all of the fabulous clinicians out there. But then I took a little bit of a turn. I ended up transitioning over to a program director role within another healthcare system. And I was with inpatient rehab. Asked me if I had any experience in inpatient rehab. That would be a big old no. And, it was 8 months that I was about 8 months to 9 months within that position. And I said that I really gained more knowledge, skill set, and learned so much about myself, which has led me now down to the path of becoming a credentialed and certified life coach, hopefully by the end of the year. So I am like knee deep in all of the coursework that goes along with that, but really, has brought to me the need, through my many experiences managing and working with different clinicians and enjoying how we can tap into these different folks that have amazing passion and talent, elevate them up, and just see the ripple effects that go across and how many people can be impacted. And so that's kind of where I am at this moment. That's been my journey so far.
Yeah, I told a good friend of mine, Jerry Durham, right? He's host of the Client Experience podcast, and he reached out to me, and I just said, if you want to tap into who's probably making bigger waves in the space of just leadership, women's health, just communication, professional development. Michelle Figueira probably is the most underpriced talent, in terms of negotiating. And you created that environment for that occupational therapist to approach you, right? Because professional development, personal development, all of that really grows when the environment and the conditions are perfect, right? I mean, and therapists have come to me and said, I feel stifled by my hospital system. I feel stifled by my management. I have these great ideas. I want to help people, and I'm just getting rejection after rejection after rejection. And part of that is like things that we can do and work on ourselves. The other is just the environment. And I want to just rip the Band-Aid off. Are there some environments that are just not conducive to professional growth and development?
I'd love to say no, but yes, there are. And I appreciate that question, because I think we all then look to ourselves as the potential challenge, the problem. What am I doing wrong? There's got to be something I'm doing wrong that is not producing the results that I want, or what the team wants, and, I myself, I had two different experiences, and I'm just gonna be very, very transparent and honest. One thing with me is a core value of me is authenticity. And so I will definitely tell you straight up, I worked in a environment and in a culture that was nirvana for change. I mean, it was just so many opportunities, and there was deep trust and connection with the people I was working with that allowed me to really take the reins and make huge impacts. And then I had kind of a completely opposite experience with another leadership role that I stepped into. And honestly, I was fighting wars I didn't know I was involved in. And that was very difficult, because, as a leader who is just so excited, you have a passion, you have a story to tell. And it's an important one, and the value. And then when you hit, these constant roadblocks, it really does make you stop for a moment and figure out, okay, how do I move through this? What does that look like? And there are many pieces to the whole of dissecting that down and helping people to walk that path, because, there's many different directions it can take, but it's also being supported by people that are good mentors. I think that's one of the things that has really been really influential for me, is partnering and establishing relationships with other women, other healthcare providers to lean into when you have those moments where nothing is going right and it just sucks and you're so frustrated. But to really lean into that, get the support, and then bring yourself back and look through the reframe of it. Where can I have an impact? Or, there's many different paths. Maybe this path that I'm going down isn't the right one for me. Let's look outside of that. And what does that look like? That's where I really enjoy asking the questions to unpack that part of it, and so to really help people and help different clinicians that are facing these challenges to be able to see that there is more out there. You're incredibly frustrated right now, but there are options. There definitely are options, and you will have an impact. It's not easy. It's not meant to be easy, though.
When you had kind of that conversation, maybe weeks or months later, with that same therapist who approached you, said, Michelle, there's this mom. She's in the NICU. She has twins. She's not feeling supported. You obviously created an environment for her to approach you with an idea of offering rehab occupational therapy services on the maternity unit. You created that environment, and you readily recognized that when you yourself weren't in an environment that you could grow, you were able to see it. It was like just like clear as day. Take me back to that point when you knew this type of program that offered something completely new, that involved financial conversations with leadership to start. You knew that this was going to take a team effort, and that therapist was going to have to stretch herself. How did you get her to a point where, giving presentations? I mean, ultimately what happened in that health system, Michelle, we should just talk about it. This stretched to 12 different hospitals offering rehab on the maternity unit before moms went home. What you did and the ripple effect of that conversation that she had with you, that stretched so much more than you probably expected it would stretch. What were the things that you either told her or talked about that kind of like started to cause that to unfold? What was the conversation like?
I think, when you see one of the blessings that I've had as a leader is that I've really been able to see the potential in people before they can even see it themselves. And I think that is one of the things that was really helped to bring this individual up to such a thriving level and really grow that confidence so that she can effectively communicate across, tell the story, and really, I kind of think of it like as an infection to everybody, because she really did. She just blossomed in front of us. And I think really just tapping into those strengths and also building trust with each other, that she was able to receive my feedback, in different areas, and I think sometimes feedback, it's such a gift, but just as communication, I'm sure we'll talk more about this. It's not necessarily sometimes what you say, but it is how you say it. And so trying to figure out for her, how can I reach her? How does she prefer feedback so that I can get the best out of her, so that she can see not that I want to change her or that I have any ulterior, motive in any sense, but to bring her to the highest level that I knew she could go to. And so I think that that's where for us, it took time. It took a lot of time, and it took us sometimes holding on dearly to each other too, and developing our relationship, but always knowing that, my job to her was to support her and allow her to lean into me as a leader when she felt insecure and she wasn't sure where to go next. And I think a lot of it is, not necessarily telling, but asking questions. Why do you feel that way? Well, there's a truth behind that, and so a lot of times people's discovery into themselves is best found through themselves, not through somebody telling them. So I think trying to weave that path for her, that was helpful and beneficial to get her to that point where she took it away. Just really was a powerhouse.
Michelle, we're going through a course right now that you taught for us. And just for me, it's the second time around, because in preparation for this interview with you, I just had to like kind of remind myself of just these key points I took away. And I'm realizing this is like a master class that you've given to therapists, specifically those therapists who are starting like rehab programs on the maternity unit. Like it's just such a rare deal. And I don't think that I think that how we've explained it in the past is like, you're starting a program like you would after any surgery. This is not the same thing. It totally isn't, because a lot of times, like if I wanted to start, I was involved in an oncology program where we were doing like cardiovascular testing in the hospital for those patients who had chemotherapy, just because we wanted to just catch if there were like any adverse effects from that medication. We never had to answer questions about money, like we didn't have to get into like the nitty gritty of how much of this would cost. We just had an idea to serve a specific population. And it was more about the protocol, that we were going to be using for those patients. It wasn't about the financial barriers that I didn't know how much my services cost in the hospital. And so when I'm going through your program again, this course that you taught, and I'm just like, holy cow, this is so tangible. You're telling us to get the foundation, which is building relationships with other therapists and then with our peers on the maternity unit, nurses, and starting with basic stuff, asking them about how their day-to-day is, asking them about what their roles are, following them, observing them, just sitting with them and just getting to know nurses. And I'm like, this is a masterclass in just communication at the hospital level and about building relationships. And I just realized like, that seems so basic, but it's something that I think we overlook if we're staff and clinical therapists and we just come in, we look for our lists, we see our patients, and we go home. And we just talk to the people that we have to talk to. But if we're building a program, it's a different set of skills that we need. Why did you feel it was important to just go through those soft skills first and just set the foundation for communication? Why was that important with this particular population specifically?
That's a great question. I think that, as you were talking through it, I just think of, you're right. I mean, think of how many distractions we have in a given day personally, and then add into it a hospital where you've got your, I don't know if your phone or however, you get the bells and whistles that you're pulled in 15 different directions. And what's the most impactful thing you can do? Take all that junk, throw it aside, sit down and look somebody in the eye and give them your presence. That's something I really, I hold on so dearly, because it's so hard in this day and age to get somebody to give you that time and to look at them and to listen to them. And that's for me, like where the foundation of connection is. If you see me and you're looking at me and you're asking me and you're remembering things, that's a game changer as far as my experience has been, where people really know, like, you know more about, you care about me. I trust you. Now I can trust you. And now you can have that buy-in and that person who really can sit down. And, you know, a lot of the times we're frontline staff, we've got to get through our list. We got to get through our tasks, but we're so passionate. We forget that people receive questions so much better than being told. And so a lot of times part of this is trying to figure out, you're right, like, how do I ask the question to lead the person to the answer that I want, you know, and to unpack that. And then take it so much deeper and say, but first I gotta check my ego, I gotta detach, and I gotta remove my bias a little bit, because their answer that they give may not be what I want it to be, you know? And so I have to be ready to take it, be very curious, because that's the antidote to judgment, and then dig into it and say, okay, well, tell me more. Tell me more about that experience or that reason that you feel that therapy is not warranted or for whatnot, you know, and to really dig into it. And that's where the magic happens, as far as I'm concerned, is that's when you get to the real meat and potatoes of collaboration and bringing people in, because the beauty of it all is that you're going to come to the table with this plan. It's going to be a beautiful plan. It's going to be very comprehensive, I'm sure. And then you're going to have it all ready to go. And then you're going to talk to somebody, and that plan, you're just going to go, well, that doesn't, what you just told me, that's magic. I need to put that in my plan. And so I think coming into it, realizing that we got to hold loosely to the guidance of our checklist. I love a good checklist. I have them like all over here, but also part of that whole magic of moving forward and really integrating for sustainability programs is bringing people along and making them part of it and weaving them in like a tapestry of the story themselves. And it's beautiful and it's hard and it's frustrating and it's so satisfying to know that you're making those impacts and you are moving the needle, you know? So yeah, that's, I hope that answers your question.
It really does. I wanted to just like say, when I went through your course, so I went through it first in January. By February, I went to APTA CSM, and I've been like really public about this because it just blew me away. I consulted with a lead therapist from the Women's Health Physical Therapy team from Duke in 2022 and 2023. And we just like hashed out, it was a good 60 to 90 minutes of just like talking across those two calls and answering just a lot of questions, getting into the nitty gritty of just how I would sit on the maternity unit and just talk to nurses and just get to know them, right? When I was first like starting to have a real presence there and answering questions that would have been pushback had I just not been there. It would have just been, I don't see a need for you. But me being there, asking and answering and just getting to know them was a complete game changer. And so I'm sitting in the audience, and the lead therapist is kind of going through how they started their program at Duke University. And she's talking about how they just stayed on the unit every day and just showed up. And they would just be there on the unit. They wouldn't go anywhere else. They weren't like called to a different floor. They were there on the maternity unit with the nurses at the nursing station and just there. And they created this, like, just built a relationship day by day by day until there was just such an understanding on the nurses' part of, oh my gosh, you could do that, and you could do this, and you could do that too. And I'm going through your course in January. I'm going through it again in preparation for this talk. And I'm like, Michelle's talking about building relationships. This is such a theme, right? That we never really talked about it in terms of, here's the building block. If you want hospitals to say yes, you want to really have an impact from your specialty, from your profession in maternal care, this is how you show up. And I promise you, when I spoke with a doula who did the same thing, she built this program and it started volunteer. And now the hospital is just part of the hospital. Like, the hospital provides it, but they provide doula services to every patient who wants one. But before they did that, Michelle, she was literally going in with her volunteers and just showing up and just saying, we're here. And it's over and over and over. So I want you to just, if you can, to bring this full circle, how important is it that we build relationships first before we go anywhere else?
I mean, I think it's It's the foundation, the building blocks. Without it, you're going to have holes, and it's going to be significantly more challenging because you're going to be fighting against something that you know is important, but you have to think of it so much higher, and realize that everybody, like, your hands are together. Just think of like passing together, and it's not pushing somebody, but you want them to hold your hand. You want them, and the only way to do that really is to take the time and slow down and get to know people and get to know them as they're, as nurses, as moms, as wives, as and it makes a huge impact. It seems so simple, right? It's so simple. And when you are put in situations where you're pulled in 15,000 directions, it's so hard, but really, I think that when you get to it, the foundation is trust, connection, and building that together really just puts you so much further ahead, and really allows the process to be very enjoyable in so many ways. Because when you walk away, this isn't the last time you're going to work with that person. As the programs that I've built, I built a fees, and I'm a physical therapist, not a speech therapist. I built a fees program very similar to the postpartum program through Centera.
What is that? What is that for people who don't know?
So fiber optic endoscopic evaluation swallow, still have it. But basically one of the things that we had found was that there definitely was a need to bring up the skill set and practice, and have our speech therapist practice at the top of their license. And so what we found was that the current standards that were in place were below where they should be. So I was tasked to kind of revamp the whole system, and through that process, put together a 40-page toolkit with the help of a couple of incredibly talented speech therapists. They're just phenomenal people and speech therapists. Huge shout out to them. But also then work through the process with many different of the different hospitals to actually purchase the equipment, and very much so just ground up. How do we, they've never seen that this little scope come through, and you're going to do what to what, and to help the speech therapists unpack that to their team, to their doctors, to their ENTs, to their, the hospitalists, so that they knew those services were there, and that we're really elevating everything up, and we're providing the best care utilizing the evidence-based practices. So, it really, I've gone through a couple of different program developments, and both of those, really start with asking questions and understanding, seeking to understand. And then from that point, you're able to build the relationships, the trust, the connection, and begin to move the pieces together.
How much does money play into program development in the hospital?
That's a good question. But, the two experiences that I had, one was for a nonprofit and one was for a for-profit. So I definitely saw a very different approach to moving through the process. The one thing I will say is that when you're working, the difference really was within the cultures, quite frankly, and independent of for-profit, nonprofit. I found with working through my nonprofit that there was a little bit more laxity, but we brought the conversation and did the work underbelly to be able to come to the table with all of the pieces together and almost reverse engineer it in a sense. What do we want? Well, we want to be the best. We want to offer the best care to our moms. That's all of our goals. What does that look like? Well, our vision is future vision of it. Every mom gets a therapy consult after C-section. Okay, that's great. Okay, well, how do we make that happen? And I think the difference in those two organizations were problem-based approaches versus solution-based approaches. And so through my nonprofit, through Centera, it was very solution-based. Great. Okay, yes, we're going to have barriers. We're going to have challenges. We only have so many therapists. There's not enough of us. How are we going to do the best that we can to execute the plan and the goal that we all set this goal? And I think that really helped to move this along and to really bring it, to light. Whereas the other organization, it was a little bit more very problem-based, barrier. And, that was certainly challenging to be able to work through and to get traction. My biggest thing is when you're looking at these two situations, well, where do you start? And I always work with the willing. You got to get momentum. work with the willing, and then begin to move the needle, build the process, and see where everything lies. Because the plan is always going to change, and you need to be flexible with that. But really tapping into those people that are going to be able to help you and to build and to bring those building blocks together.
When you say problem based, maybe I had a different envision of that, but I kind of think of there almost needs to be like an accident at a traffic intersection before a traffic light is put up or a stop sign is put up. That would be problem based. Is that right? Versus solution based. Can you explain that just a little bit more?
Yeah, I feel like, when I look at problem based, I'm really looking at, when you come to the table with folks and, you say, okay, we need to put that light up because there was this god awful accident. And this is the 10th one in a month, well, I don't have I don't have the manpower to put that up there. Well, what if we change the schedules? Well, I don't think so-and-so is going to work with that. It's not going to work. Okay, well, can we find an alternative to this? Well, I don't quite know. What do you mean an alternative? You know what I mean? So it's like this perpetual, for me, when I think of like a problem base, it's constantly the barriers. There's a challenge to every solution you bring versus when you look at solution based, everybody is really rowing in the same direction, recognizing that there are going to be challenges. It's not going to be perfect. We don't have all the answers. And I think that that's where those two cultures really, really kind of start to get the feel of when you're within those cultures, those differences, and identify what's making this one work and what is making this one not work.
Wow, it's so funny. So right after their presentation, right, the OBGYN that was presenting with the Duke Women's Health Physical Therapy team kind of answered a question in a way that just reminded me of that. He asked the person who had a great question. It was something on the lines of, this OBGYN just doesn't see a need for our services. This doesn't see a need for, whether offering, rehab services on the maternity unit or close to after birth, maybe something telehealth or home health wise or something where they wanted to offer those rehab services earlier than the standard of care. But the OBGYN was just like, no, just wouldn't refer. And the OBGYN from Duke had the best response. He was just like, was this an old, man or something like that, first of all. And then he just kind of alluded to yeah, that generation just needs to retire. And I just realized, I was just, what? I mean, he's right. There are just some problem based cultures where it's just, no, every solution that you think you have, that you want to try, every idea is just like, no, that just seems too much work. Or no, we don't have the staff for that. Or no, we just don't have the funds for that. Or the reimbursement's too low. Or we have to get these moms out and discharged. No, 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 no. It's now you have to really look at, well, what's outside of the system, right? Because you're not going to change what's in it. You almost have to create something new to replace the one that exists, right? That's a quote, and it's like, it'll come to me, obviously, after we're done talking. But Michelle, I mean, doesn't that resonate with where you were with these two systems? You could see one was headed in one direction and it was just easy to follow that wave, and the other was just a wall. And then you had to just look outside of it.
Yeah. And honestly, there's so much to it as well. I mean, it's a process. It's a process to accept it. It's almost like you grieve it, quite frankly, because you have this idea and, you're constantly trying to find solutions to problems that you can't control. You start to realize then, after kind of taking a moment and detaching, like, I'm not the problem. I am not the problem. You're the problem. And that's okay. It really, and then for me, it took some time to accept it, because I'm like many high achieving women. We're just going to keep going. We're going to figure this out. I'm going to get to them. they're going to see that. I'm going to ask it in a different way. I'm going to bend over backwards, do 5 somersaults, serve them chocolate cake at the end. They're going to love it. They're going to love it. And every single time I had chocolate cake in my face, and at the end of the day, you start to just really kind of look at it and sit in it, and then be able to move past it and it's not for nothing. You're going to learn tremendous things about yourself, about systems. You're going to have experiences that you're going to take with you through your personal and professional life. But it's okay to move on. It is okay. It is not a failure. And there are probably 5 different paths out there for any clinician to walk through. And you have choices. And those choices are fantastic, beautiful, and your own. Because you have a story, you have a passion, and you will get there. You're exactly where you're meant to be, especially with something that I leaned so heavily into. I walked through 2 bouts of burnout myself, and it was awful, and I'm so grateful for it. But one of the comforting things that I always leaned into was I'm exactly where I'm meant to be. And you don't want to be, you want to be somewhere else, but at the end of the day, your inner critic is telling you all of these things. And I call her my little inner wise woman, and little Elaine comes out and she's like, no, you're where you need to be at. And it's okay. This is important. You are on your path, and I know that sometimes that can be very frustrating when you don't see that path clearly in front of you, so hang in there.
I felt like this is a little. You're gonna have to invoice me later because this is a little bit of coaching for me. But no, I mean, I promise you, like last week, just a week ago, a therapist approached me. I have been wanting to work in this particular health system that's local to my community for years, and I've applied several times. I wanted to just get in there because on the outside, I was providing private cash pay physical therapy services, where I just felt like, goodness, it would be so much easier if acute care therapists just at least gave just a little bit of education to moms after C-section before they went home. And it would make more sense, like businesses like mine, to fill in that gap. But I needed to understand because I couldn't. For the life of me, we had done so much education local to our community that I didn't realize maybe being inside of this hospital, I can understand the culture and understand like, well, how hard would it be to offer rehab services on the maternity unit in this hospital? I mean, it's a super like well-known hospital for birthing care. And so I got in. I'm a acute care therapist, staff therapist. I'm in. And a therapist approached me and said she took my course 4 years ago. And I wrote about this recently. And she's just been trying, trying, trying. And Michelle, I've been there less than a month. And I'm like, this is not gonna happen. This just not the place. Like I can tell you, like, to the depth of my being, is like I've now been in this for so long. Like I'm going on my 10th year, which to you is like, oh, cute. Well, I'm going on my 10th year of practice as a therapist. I've started programs after mastectomy, after hysterectomy, for women to get like early rehab after C-section, obviously, while they were still in the hospital. And I can spot a hospital within days to say, this is not going to happen here. It would have to be such a strong tidal wave of every hospital around the country doing it. And this would be the last one that would finally flip, because the culture is so embedded in how they think that it would just not be worth my time. And I never really just thought to just say that publicly like I'm doing now. I have been coddling therapists. You could do it, have the conversation, do the pitch, do the in-service, talk to your manager, all of it, talk to your colleagues. And it's like, when you just know, but then what's the other alternative? Where do they go from there? Who do they talk to? Because it can be such a huge letdown when they know they want to do this thing and they're just stuck. What do you do?
Yeah. Oh gosh, I just listened to this podcast. I'll have to send it to you and see if you can put it out there, because it talks exactly of that situation. And the lady does a beautiful job really summarizing up, you're not meant to save them, and that hit me between the eyes when she said that. But also, your role in that system has created waves that far reach anything that you'll see at this moment. You have an impact. And I think that leaning into that a little bit as well, even though the outcome isn't the same as what you would want it to be. But that was something that it was empowering to me to accept it, take 2 hands, hold on to it. Yeah, I'm not meant to save them. And I'm walking away with this, and I know I created incredible change to at least expose others in that area that there's another way. And I did have a therapist come to me and really give me that feedback that meant the world to me, because they've only ever known that culture that way. And they felt that the way that it was run was the way it's run everywhere. And so coming in, you're so peppy, you're ready to go, and everything, you're so excited. And to see somebody in that, they're like, that was weird. That was odd. And that was strange. And for me, I learned like, that's good feedback. That's really good feedback. And it also gives me insight to see that. The challenge though is when you step away. What this woman talked about was, we want to be like, oh, it's okay to not get credit about, with all of the things that you're doing and the change that you created, because you are a change agent, 100%. We all are. And the fact is, when we walk away, many times we don't get credit. We don't get mentioned. we're kind of gone. And it does hurt sometimes, because I think as you become more empowered and you understand yourself, you trust yourself more, you realize that stinks. I worked so hard and really made um, great impact to so many people, even though I didn't move the needle anywhere near I wanted to. But I have to step away, because what's most important is not saving them, but saving myself. That environment, sometimes looking at it from the standpoint of the culture will change you far quicker than you will change that culture. And so, that was something that I think helps to clarify folks that are in these situations. I know part of this was finding people to be able to talk to and to give me honest feedback, to tell me I'm not crazy, one, because I thought I was crazy. Like, how's this, and I'm sure the same way with you. Like, what am I missing? I've got to be missing something. But to be able to get yourself a core group of people that you trust and that want the best for you, and that are able to help speak into your life. You don't give everybody that power, but you need to have a couple people in your life that you're able to use them as a sounding board to give you some clarity when it gets really muddy. Because you're right, Rebecca, like now you can see it so clearly. I mean, you can step into it. I know what it feels like. I know what it smells like. I know what it looks like. And I can identify it like that. But for other folks that don't have exposure to what is outside of those walls, sometimes it really can be a much longer journey to get to the outside.
What's interesting, and we may have to have like a private coaching call, because now that I do see it, now that I see a hospital, like what a hospital looks like, who you're not going to start programs on the inside. That's going to be revolutionary for what you want or what you see is needed, for a specific population. Obviously, we're talking about maternal health. I can see that now. I've been in it. I've been on that side. I've had a wonderful, like you, I had such a long, successful run of just all these different systems, changing so many different things, being in it, being on the ground, doing the pitch, getting no, all of that. I know what that feels like. But now I also know of what is it just what it means to like get the no and just know it's a not right now. It's a hard not right now, or it's a find another way. And another way that I'm thinking of is how to get hospitals to say yes to rehab on the maternity unit is to come out as an outside entity. Because I know there's no competition still. There's no one in that hospital that's going to say, oh, we're a rehab department. We can cover that unit too. You guys have no interest. I know that. And so as an outside entity, I just feel like there's so much more that you being on the inside as an acute care manager, director of rehab, how the hospital system works. That's why I say, and I told Jerry, I was like, she's one of the most underpriced negotiators in our field, right? Because Michelle, you know how to talk to leadership, how to navigate conversations that are just hard, and how to get therapists to really tell their story and tell the stories of their patients that can't speak for themselves, like, that therapist did with the mom in the NICU. Like when she told that story publicly and I listened to it, she had asked the mom, how are you? And she held us in that. She held us in that moment. We were in the room within the NICU, and we could feel the overwhelm that person must have felt. And it just all made sense from there. There was no argument against her question to you, which was, why not? Why not offer rehab services on the maternity unit? Why not offer it specifically to this patient population after C-section? And then you shared your story, right, as well. And I just feel like a lot of this starts with just recognizing, like you said, where you are, who you're around, what's the bigger question that we're really asking, but then also stepping up to tell our story. Is that something that you would be willing to share? Is like, what is your story in this as it pertains to maternal health? Like, do you have a story that you'd be willing to share?
For as far as like
Yeah, your
my
own personal experience.
well, I mean, I've had two C-sections, and before really, and it's embarrassing in a sense, but I'm going to be very honest. Yeah, I kind of knew very superficially what it was, but until I was working with the girls to better understand, as we asked the nurses what their day-to-day looked like, and then what is the surgical procedure, and then seeing how invasive it is. I was like, well, no wonder I hurt so much. God bless. That sucked. And that was really, that was really impactful. And so for me, I found it very difficult to function. I dealt with challenges with, some postpartum depression on top of C-section and having to care for this little baby and try to take care of myself and deal with what I thought motherhood looked like, and then what the reality motherhood looked like was two very different things. And it really brings me to a time in my life where it was so challenging, and I wish I would have had some of the tools that I've learned since then earlier on to get me through some of those really challenging times. My goodness, to have somebody come into my room and be present with me, even though I'm a physical therapist and I know how to log roll, no, I need you to treat me like a patient, that I don't know anything, because I'm a mom first and I'm hurting and I'm in pain and I feel very vulnerable. And my world, as joyful as it is, has literally been turned upside down too. And we always want to say like, oh, it's all rainbows and roses and sunshine. And there are absolutely parts of that, and it's beautiful, but also there are really, really hard parts. And so I think that, tapping into those stories and our own personal experience really lends itself to be able to paint that picture of the necessity of our roles and how specialized we are and our unique skill set that can make such a positive impact on the care that we give to our moms.
Michelle, do you think that that has a place in an in-service? Like in an in-service or in a pitch to management, do our personal stories have a place?
I think they do. I think you have to know your audience. You have to know your management, particularly. Part of the process is not only getting to know the nursing, but also to know the upper part to the best of your abilities, upper management. And so I think that you have to put part of the story in, but you would benefit from maybe talking with somebody to be able to find out what's the right tone and what's the right slant in some circumstances, because I know some leaders are very warm and receptive. And then there are some that, have a different tact, and different characteristics, that they're very strong leaders, but, that might not land, especially if you kind of paint the picture a little bit, in length to a degree. So it is knowing, I'm probably not going to paint that same picture to my CFO as I am to maybe my frontline staff members or to my nursing staff. So it's getting to know your stakeholders and your audience a little bit better. I'm sorry, I know the sun is like changing right now. I'm trying to get it out, so I apologize.
Yeah, no problem. And you just like when you mentioned CFO, how important do you think it is to like just understand the financials of your hospital? Like when I say financials, like the financial goals, how much you cost as a therapist, your billing, all of that. How much also does that play into? Because I understand you started not just the fees program, not just the inpatient postpartum rehab program, but also like voice dictation for our documentation system, which I feel like every acute care therapist, like for the record, should be like having some way to make this so much more easier. And voice dictation, I'm like, why haven't we been using that? But I digress. You did that all in this health system that also like championed the maternal rehab services, before discharge. And I'm just like, okay, how did you get around the big question about money? I have to keep coming back to that because that's such a huge barrier. Like it just keeps coming up in our forums and our questions from therapists who want to start these programs is money, 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 reimbursement, cost. How do you even talk to the CFO as a staff therapist? How do you go from that to someone who's pitching a program?
Boy, that's a great question. And there's so many different levels, I feel like, to it. I think that for me in particular, getting your upper management leadership like in your back pocket, carrying around with you is crucial and essential to be able to get access, just to get access to the information. Not even to digest it, because it's not exactly, it's a different language. Honestly, when you get those spreadsheets and you're like, well, geez, there's just numbers. I don't know. Is this a good thing? Does this number mean, like, am I okay? But to really be, it's a big process to walk through that. So getting your hospital or your hospital leadership on board. And then honestly, the thing that worked well with me, I became pretty close with my CFO because he's the expert and I want to know as much as possible. So ask him to honestly mentor and teach me is what I did. I need to know more. Can I meet with you? And I think that's where your control comes in, is stepping outside of your comfort zone and making yourself vulnerable All they can say is no, but what if they say yes? And that's going to get you another step closer and get you to where you need to be able to get the information, to have somebody tell you the information, explain it, and then you get to digest it and start to see that big picture. Like, oh, okay. This is the why behind why we might have to do it this way. I would love to do it this way, but I get it now. I understand. I have my why, and now I can move through it without being resentful or frustrated because I see that there's a reason for this, you know? So I think that now that kind of answers it a little bit, but at least get you walking through that path. And then, sometimes, it kind of comes down to everything that we've talked about, it being flexible and getting that, yeah, it is a business. Healthcare is a business, but there's a both and here. And how do we make that a both and, not a no, because of pure financial reason? Well, then we better be cutting other places too.
Wow. Yeah.
Give me the spreadsheet. Let's start going, But I think the other part is just one thing. I love humor and really interjecting that in to conversations, especially when you're coming in not knowing and having a real skill set in that area. Being able to have that back and forth really kind of de-escalates. It makes you comfortable. It brings the other person humor, comfort. They enjoy being with you, which makes that next appointment that you want to make a better probability of yes. Oh yeah, I'll meet with you. That's no problem. Great. Thank you so much. I really appreciate your time. I have a lot of, showing gratitude towards it. So yeah.
All right. I have an insider question for you. So, rehab therapists, do they make the hospital money or not? Like the productivity thing, what is that about? I don't get it. Yeah, I'm like, are we making the hospital money? Are we saving the hospital money? Like, are we billing? Like, I don't get it. Is there a quick answer to that at all?
No, I can't. No.
Like, it's so hard, Michelle. Like, I don't get it. Like, there was one hospital I was working at, right? We had Epic, and it would actually populate our charges.
Mm-hmm.
And in one day, I billed $5,000. I'm like, serious? Do I cost that much?
Well, and it's like it depends too, like who you're talking to and what they constitute making money, like, because if they're under a certain billing, they're under a DRG. So we can see them one time or 20 times in that day. The patient doesn't get charged more. So, you know what I mean? And so but then if you have a patient that's under observation, there's real charges there, and so it is gray, muddy.
And that's like, you don't even like doing it. And so if a staff therapist is like asking us, well, how did you get around the finances? And I'm like, I don't really know. Like, they never really came up because our pitch was so based in reducing readmissions. That was really kind of my angle, personally. Like, it was 3 patients, all primary C-sections. They were first time moms. They were first time major abdominal surgeries. They all came back to the hospital. And when we calculated the length of stay average that they were readmitted back to the hospital, was 9 days. But they were discharged within the first 48 hours. So it was like, hey, had we maybe moved a few extra days on the front end and given them the recovery and the rehab, that we would have given anyone after a major abdominal surgery, we could have prevented the readmission and we could have prevented the extra length of stay that they needed in that readmission. And it just ended up saving the hospital more money when they looked at it, but I never got those numbers. And I just got so frustrated with like not knowing how much I was worth. How much am I worth to the system? Still don't know.
Well, and that's a really good point that you bring up. One thing that I did find looking at the different data points and metrics that were tracked was when we looked at different hospital systems that had the higher acuity moms, their length of stay obviously was much longer. And one of the things that for me, I would have loved to have been able to track and dig into that honestly, or like a research level, would be looking at after post therapy intervention, how much did we affect in a positive way, reducing the length of stay for those moms, saving the hospital money, but also getting mom back to the baby and, looking at it from that standpoint. So you're right. I mean, there's so many, my brain kind of exploded with so many ideas of different rabbit holes to go down to. But yeah, I think that there's ways to quantify it, but it's still very challenging at times to be able to capture what we know is really where it's really going to show that true picture. With the readmissions and whatnot. So I know I didn't say that very clearly.
No, you did. Michelle, honestly, is a perfect segue because at the end of their presentation, kind of towards the end, Duke announced that they had calculated what their cost savings were from
Mhm.
reducing readmissions. It was over $500,000. Over $500,000 in an 18-month period of offering physical therapy in the hospital after birth. And they went even beyond C-sections. They were sometimes seeing moms with like, I mean, just difficulty walking, just moving out of bed, for whatever reason, vaginal delivery, even high risk pregnancy, all of it. And they calculated those services as well as telehealth services. And I just thought to myself, man, those consultations were free. Like, I need to talk to Michelle. Like, how much like is one conversation with me? No, I mean, but seriously, like if we could save hospitals dollars in maternal health, and we're so underpriced as physical and occupational therapists, like how do we sell ourselves? And I mean, really, I mean, that's how I want to end with you, Michelle. Like, how do we sell ourselves as a rehab therapist with anything that we're doing?
Oh man. Well, one thing I have to say, you kind of made me think of something as you were talking. I there has to be a stronger relationship, honestly, with the higher um, upper level executive rehab leadership team with the people that are probably hunkered down somewhere undisclosed location who are doing the billing and projecting out all of the costs. Because I think that our roles are very formed, and we're doing the things that we need to do on a day-to-day basis, but there's a large gap of contact between those people and the folks that are kind of managing those hospital systems. So I think that they're really, boy, wouldn't it be of a benefit to be able to at least bring people closer together? And I find that that's sometimes all that needs to happen is a conversation. Start a conversation and then see what comes of it. You never know what you're going to unpack and what wonderful knowledge is going to, come from those connections. But that was the first thing I thought of. So I'm like, I don't know that I've been exposed to anybody who really actually has access to that level that could really be able to help show those positive gains.
Michelle, you are going to be sought after. I have a feeling for people, and I think even more for leadership, the leaders, this is going out to you. You want to start services. You want to start something, even like the fees, a program that you started, for speech therapy. You have stretched yourself in so many different directions, efficient billing for rehab therapists in the hospital. I think there's just so much potential for these consultations to just snowball into these massive saving programs, and that's where it's just like, okay, Michelle, here's the time now. Like, how do people reach you? How do people like get in touch with you? What services are you providing? Can you just like kind of pitch to us a little bit? Just what is the value of having these conversations if you're in leadership to really understand the ins and outs of program development? Because I think it's just an untapped opportunity for us to be really on the front line of program development as rehab leaders. What would be your pitch for people to have these conversations sooner rather than later?
That's a great question. I think that the first thing that comes to my mind when you're talking is just the curiosity and finding out the why. I think that that is such a beautiful start that really allows you to be able to move through some of the barriers and processes and really get that. I mean, in the connection, honestly, is establishing a connection. I think that it's not an easy path. It's something that's going to really evolve yourself, and you're going to learn things about yourself. I think really giving some good reflection. Obviously I'm going into life coaching and really pushing into that area where I want to expand into executive leadership. And part of that was my ability to identify that there's a real need out there for us to support our leaders. They are not supported. They are not given the tools. They are said, here, lead these people, good luck. And by the way, we're going to meet and I want to know why you're not getting your metrics met. And I think that there's a space out there that is of dire need for us to be able to walk with leaders out there that are making and who will potentially make all of these changes that we know need to occur, and to be able to support them, give them those tools, and to be able to guide them through and support to the best. So I don't know. It's something so near and dear to me. And I am really just saying, to anybody that has any questions to me, please, by all means, I'm here to support. I'd love to be a sounding board and to just let you all know that you're not alone. One of the best quotes and I think I shared this with you the last time that we spoke, was there's no better person than who you are right now to help the person you were yesterday. And so, just hold on to that and realize that we're all trying to just better ourselves, and it's messy, ugly, and beautiful.
That's awesome. Michelle, how can people reach you?
So right now, I'm actually going to work with you, Rebecca, to help out with that. I'm on LinkedIn, so you can look me up on LinkedIn, on Facebook as well. I'm looking to expand out since I'm just starting my coaching journey. I haven't really gotten anything out there live, but I'm certainly working in that direction over the next couple of months to be able to take on clients. So if you're somebody that would like to know more about coaching, like what is this coaching? How's it different from mentorship? How's it different from consulting? How's it different from therapy? Please, please, please contact me. I'd say on LinkedIn would be the best way. And I'd be happy to talk through it all.
I'm just going to prepare you for our first session because I'm a lot, right? No, and
I got
obviously, like, stretching this time with you live, in front of people. I'll be honest with you, I'm a lot. I'm a lot to handle. And my first coaching call with you, and I'm just going to prepare you. You don't have to answer it now because or you can send me the invoice and you can answer it now. But for me, I have now been approached by 4 hospitals in this May. I mean, no, it's not even May. We're in April, Michelle. And I don't know how to kind of separate because I give so much away for free. I'm writing for journals, and we don't get reimbursed for our time as authors for research journals. So I've written for now 2 major journals. We've written 3 commentaries. I've created with a surgeon a cesarean delivery rehab protocol that's out there for free. Have Zoom calls like this, live streams on these topics. I can't tell you how much of my time I've poured into not just improving maternal health. That's what I'm known for, but my passion actually was in oncology, and it was on leadership development and early intervention and care and all of that. And so there's always in me this yes, yes, yes person that will say yes to a coffee date, yes to a question on Zoom, yes to an hour-long conversation to pick my brain. But now is getting to the point where, okay, if hospitals are getting to the point from a consult call with me where they can save their system over $500,000 and I didn't get a coffee, I'm thinking like, well, I'm stretching myself to the point where there's now going to be burnout into an area of practice that I wasn't trained to really be in. I wasn't trained to do any consulting. So I don't want to burn out from this. I want to still give. But where's that fine line of now you're actually moving more into consulting? For a system. I don't even know how to invoice that, And so I really want to kind of like get into the coaching. I think, and to me, you're the perfect person. I don't know anyone in the coaching consulting space at all who can like answer my specific questions, who like know my pain points more than you. And that's, to me, this is kind of like just important to me. Like we have these conversations out in the open so that people can know like, hey, wow, Rebecca's in a whole different realm. She's not providing physical therapy services to the patient or getting pushed back in the hospital. She's working at such a different level. And so her coaching and mentorship is going to be needed more on the executive front, right? And people should know, like, well, what conversations would that even entail? So I can know that that's for me. And to me, you're that person. That's why I told Jerry, I was like, Jerry Durham, the most underpriced negotiator in our field, because one conversation with you will set off a cascade of things that could ultimately deliver services on a scale that we've never seen before. And that's just women's health. We're not even talking about like what you could do for speech therapy, other aspects of rehab, and other aspects of healthcare leadership. It's such an untapped resource that you have in the executive healthcare leadership space that I don't think that we even have a name for it yet. So I want to be your first, I mean, please, like, let me be your first client. Like, I have so much to like pick your brain about and just, consult with you on because, I don't want to drown. I love this work, but I can't afford to be stretched in all these different directions, right? For the work that I really want to do and for the changes that I want to see in women's health. So I really need those speed bumps around myself as well.
You just summed it right up for yourself right at the end. Yeah. Yeah. I am so honored for all of the wonderful things that you have said. And I feel the same way about you. I think you are a talent that is in a league of her own. And part of that, is trying to figure out those speed bumps and find those boundaries, and to be able to really on different levels show your value and advocate for yourself, because you're advocating so hard for so many others. You need somebody to advocate for you, and to hold, I think gently hold accountability. We all need that a little bit. So I can't wait. Let's go tomorrow, Rebecca. I'm on. Put some time. Let's go. Privilege to coach you. Absolute privilege.
Awesome. This has been so amazing. I cannot wait really to talk to you again. This will be out so that people can see show notes, how to get in contact with you. You already dropped your LinkedIn. There's probably ways to get in touch with you also, maybe through Meta, Facebook, wherever you are. But I can't wait. This is so needed for our field and beyond.
Very excited, very honored to be with you. Anytime I'm with you, I totally right there with you. We vibe, and it's just like it's great things come from it. So I so appreciate this opportunity, and I'm grateful for everybody that joined us.
Same here. Thanks, Michelle.
Take care.